And now to the latest on COVID-19 here in our state. Mississippi health officials reporting 1,452 new cases today. South Mississippi residents making up 378 of those cases. Harrison County, massive increase. It's a disturbing number here, 212 new cases. Jackson County following with 78. Out of the state's 75 newly reported deaths, 13 were South Mississippi residents. State Health Officer Dr. Thomas Dobbs sharing encouraging signs today as the average number of COVID-19 admissions to hospitals sees a drop throughout the month. This is the number of Mississippi residents receiving their COVID vaccines continues to rise. More than 62,000 vaccines administered just last week. And joining us now with a look at the continuing battle with COVID-19 and the ongoing vaccination effort, Singing River Health System CEO Lee Bond. Thanks, Lee. Always good to have you in the 4 o'clock show.
Welcome.
The Department of Health said that they expect to get about 37,000 doses a week. They're going to keep 30,000, send 7,000 to the hospitals. I thought the hospitals, you, Memorial, and other hospitals around the state, really did a great job in terms of efficiently administering the vaccines. Kind of get us up to speed on where you are right now.
So we've given out all of those. We've given out 8,325 doses as of today, and we got those doses out quickly, accurately. I'm most excited today to tell you that we received our shipment of second doses. We have all of our second doses as of today on hand, and we turned out to have made I think a good move by when people came in for their first, we scheduled their second dose, so they don't have to schedule and make an appointment. They just automatically know when to come back in the same time slot, either 3 or 4 weeks, depending on whether it was Moderna or Pfizer.
So you're getting a combination of Moderna and Pfizer?
We do. We handle both. Correct.
So, if this supply and demand continues along this road, are people going to be able to stick to that 21-day and 28-day prescribed time span between doses?
You know, I hope so, Dave. We will see what happens at the federal level and the production level, but our contention is that the best route is to try to stick to that as closely as possible. If for some reason there ends up being a supply chain disruption, there is scientific literature out there that talks about, get it as soon as you can after that period, and it still can be quite effective. But optimal is to give it as instructed.
So, there are going to be so many questions, Lee, because of supply and demand. Should people who already received a shot be ahead in line to get their second shot of people who are now ready to get their first shot? You know what I mean?
Yeah, so our thought is this. When you think about the healthcare workers that have had their lives on the line, taking care of people and saving lives every day in this country since March of last year, how can you tell a doctor in the pulmonary critical care area that he's not going to get his second dose? I think you would have anarchy among healthcare workers in the country if their second doses weren't available to them, because you need the second dose in many cases to ensure effectiveness. So yeah, I think the second doses are more important than just getting people minimally vaccinated by only having a first dose ever. So if supply chain is disrupted, I think you need to focus on the people that are out there in the middle of the war. Take care of them so they can save as many lives as possible. That's the goal in this. And everything we do, we got to think, how can we save the most lives? Which is why we got 200 first doses today, and we're going to focus those on the oldest people with the prescribed comorbidities. 200 is not enough to open up the hotline, unfortunately, and we're hoping and thinking we're going to get more first doses. But right now, we got to focus on the goal, and that's to save lives.
I don't want to, we're almost out of time. Maybe that's a good thing, Lee, because I was going to try to drag you into a little political policy debate here. The state, their website crashes, you're on hold forever. You guys seem to have just gone pretty much like this in the way you've done it. And all you got was 200 doses. Don't you think the hospital should maybe be having more of a hand in this?
Well, maybe, but I think it's actually a federal, if we got more from the federal government, it wouldn't be an issue at all. So maybe we're not going to complain. Look, if we get one dose, we'll take it. We're happy. We're not going to, rankle about it. It is what it is. But yeah, we would love more. And I think that everybody's doing, they're trying their best. And I think if the federal government could supply more, or they could work out the logistics at a federal level, I think that would be most helpful. There's 1.2 million people in the state. So you think about it at a macro level, 40,000 people a week. It's going to take forever to get everybody vaccinated. So there's a bigger problem at the federal level, I think, getting those out to these communities.
Okay, well, 3.2 million. You said 1.2 million. You're talking about people over a certain age who are going to
qualify. People that are, over a certain age or have some of the specific comorbidities that are, where they're most at risk.
Yeah.
People with COPD, kidney failure, and things like that.
Okay. Well, Lee Bond, CEO of Singing River Health System, keep up the great work over there at Singing River, Lee, and thanks for being with us.
Thank you, Dave.